All right. Hi, everyone. Welcome to the NextGen Healthcare webinar, Bridge Platform Gaps When It's Time to Rethink Your Technology. My name is Elaine Obermeyer, and I'll be your host for this session. If you have questions, please submit them electronically through the WebEx Q&A panel located on the right sidebar of your screen. We will answer all the questions at the end of this session. You can also adjust the video display of our guest speakers. Also next to the right side panel, you'll see a little layout button where you can choose, we recommend grid view, so you can see all their wonderful faces. This discussion is being recorded and a link will be sent to you for on-demand viewing via email. So now I'd like to introduce you to our distinguished speakers. From Hunterdon Healthcare, we have Jeffrey Weinstein, Executive Director and CEO. We also have Dr. Jerry Crosswimmer, Chief Medical Officer, and Karen Giannatasio, Director of Ambulatory Information Systems. Moderating today's discussion, we have Brandon Theopoulos, Vice President of Solutions Strategy. And then we also have, not pictured here, Volley Van Oort, our Director of Solutions Strategy at NextGen Healthcare, who will help moderate questions at the end. All right, Brandon, take it away.
Thank you, Elaine. Welcome, everyone. It's a pleasure to have you with us today. I am very honored to have our panelists with us from Hunterdon Healthcare, a longtime lighthouse client of ours. A little bit about Hunterdon. Elaine, if you could go to the next slide, please. And we'll hear much more about this from all three of our guests from Hunterdon in just a minute. But for those of you who aren't familiar, Hunterdon, located in New Jersey, multi-specialty health system and ambulatory multi-specialty organization, north of 100 locations and a slug of healthcare providers, 350 plus of them. With that sort of as the background, welcome everyone from Hunterdon. Jeffrey, I'll start with you. Tell us a little bit more about Hunterdon, if you would, please.
Sure. So we are a clinically integrated PHO made up of both the employed and independent physicians on our medical staff. We're half owned by the Hunterdon Medical Center, by the healthcare system, and half owned by the IPA. We're somewhat unique in that we have a closed medical staff by order of the courts back in the 70s. All the physicians who are in the IPA are part of our organization. Not all the physicians on staff at the hospital are, but the vast majority have joined our organization. We're also unique in that the physicians, with rare exception, that are in the organization share the one common platform, and that's NextGen. We deal with many other healthcare systems, both locally and out of state, where they talk about having their employed practices on one system. We're unique in that we have the independent and the employed utilizing the NextGen system.
Fantastic. And before we get into the heart of it, these are extraordinary times, to say the least, that we've been living in through the last 18 plus months. Jerry, I guess I'm interested. How is Hunterdon doing? How are things within the organization from a COVID perspective?
Well, COVID, as you said, has presented challenges to us that we never could have imagined. We're in the middle of Surge 3, as I suppose many people across the country are. We are managing, I think, quite well, although the demand is extraordinary. What's different about Surge 3 compared, for example, to Surge 1 is that during Surge 1, most things were shut down outside of the acute care facility. So we were able to tap into staff members from the practices, for example, to help out in the hospital and expand our care teams, bring equipment over, et cetera. That's not the case. We're still doing our elective surgeries now. we're still running the practices at full capacity, or in many instances, more than full capacity. People are not quite so afraid to come into the offices as they were. So COVID has changed virtually everything that we do. Telehealth has taken on a whole new meaning in the world of COVID. It takes a lot of our time as leaders to make sure that our practices know what they need to know, are completely up to date on everything that they should be doing and should not be doing. So that's been a bit of a leadership challenge as well. But I think we're doing well.
Well, I'm glad to hear that you're managing through it, and it's remarkable the amount of adaptation that all of us have had to come up with over the course of this 18 plus months, and certainly it's different than it was early in the pandemic, but I'm glad to hear you're doing okay.
I'd like to add one thing to that. Jerry mentioned telehealth, and I actually have to, it's kudos to NextGen. We made the decision very early on during the start of the pandemic that we had to stand up telehealth. We brought up the auto product, and you got us up and running in just a matter of a few weeks. So even though the practices didn't have their front doors open, patients were still able to get the care that they needed.
Well,
Karen on the call as well, because Karen, along with NextGen, just made that happen, and it made an enormous difference to us.
It was
so that's
a definite team effort, and the response and the ability and adaptability was fantastic. So kudos to all those involved, because it was much needed and much appreciated.
Well, thank you. For those in our audience who are unaware, and Jeffrey, a perfect segue into part of our conversation for today, but NextGen, through, quite frankly, just sheer good luck, but we had acquired a company that Jeffrey just mentioned. Auto Telehealth was the name of this organization. We acquired them late December 2019, literally just a few months prior to the onset of this pandemic. We had the good fortune in that Auto was a long-time integrated partner to NextGen. We have many third-party partners that are integrated in, so a lot of the heavy lifting and from an integration perspective was complete. Nonetheless, it was more dramatic than turning on a fire hose, as all of us are aware in terms of onboarding of accounts. And this is a fully integrated virtual visit solution, not something just ancillary or hanging off to the side like a Zoom or something else may be. So very proud to hear that it's been, that it was successful for you in a rapid deployment, that it is still something that is expressing and showing its value to you today. One of the comments that has always stuck with me that you have mentioned in the past is that the flexibility of NextGen is the key to your success. Tell me and our audience a little bit more about what that means to you exactly, if you would, please.
Sure, Brandon, and you're right. I have said that many, many times, actually. And we are deeply involved in care transformation, patient-centered medical home, and lots of value-based contracts where we take some risk in exchange for reward, and the reward is entirely dependent upon our performance in clinical quality measures, in patient experience, and in cost of care. And our local NextGen team has the ability to make some customizations to our templates that supports that kind of improvement in clinical quality measures, reaching the benchmarks that are set for us. It would be hard to overstate how important that has been to us. The ability for us to prompt the providers to do the right thing at the right point in their logical care delivery cascade, setting up quick buttons. I'll give you an example of that. We were trying to get our mammography rates up. Customization that our care team, our NextGen team, was able to create for us is what we call our quick button. So when they're in the right template at the right point in the visit, with a single click, they can order a mammogram without having to go through all the customary steps required to do that. Then we did the same thing for DEXA scans, and then we did the same thing for colonoscopies. And building on that has allowed us to be very high performers in those kinds of clinical quality measures. Similarly, in our advanced care planning for serious illness, we've made some lovely customizations there. And I could go on with numerous examples. Beyond just the clinical quality measures, though, we've also been successful in risk adjustment. This is entirely crucial to any organization that's in value-based care, because our hospitalization rates, cost of care, et cetera, are risk adjusted based on the complexity of our patient population. So it's crucially important for us to make sure that each complexity valued diagnosis, each diagnosis that has HCC value appears on a claim each year. So we customized a button in NextGen in order to capture the revalidation process and put it right in front of the provider at the time they're completing their assessment and plan. Incredibly valuable to us. So those are just a couple of quick examples. I could give you examples of care delivery as well, with care coordination, integrated pharmacists, integrated behavioral health, integrated nutrition, et cetera. But I'll pause there for more questions.
I love it. And we're going to come back and touch on just a few of those in a moment. Obviously, it's apparent to our audience, Hunterdon is an organization. You are more progressive. You're certainly forward-leaning and have found yourself much further along, I would suggest, than a lot of other organizations as it relates to the risk continuum and moving up into more complex arrangements. I'm delighted and very proud. It's one of our strengths, as you mentioned, that flexibility of NextGen. Karen, I'm interested. You're a large organization, very complex, as we mentioned at the top, greater than 100 locations, hundreds of providers. From a architecture perspective, the enterprise architecture, how has NextGen been for you in being able to meet the needs and demand that you've put on it?
So I'd like to clarify, Brandon, that you would actually like me to talk about enterprise chart solution, because that is a huge function that we've received benefits from. So if that's where you want me to go, happy to go there.
Let's go there.
Okay.
That often overlooked, but let's talk about enterprise chart.
Karen, can we just talk the fact that though we use your solution, we don't refer to it as that. We call it unified chart.
Yep, I was going to chat about that, Jeffrey. So good there. And the reason I want to talk about this a fair amount is because this was a change in practice for us. This really did make us think differently about how we were documenting and sharing clinical information. So I'd like to take a couple minutes to just kind of walk through the process of what we did in this conversion, because I think it will help your listeners understand what are all the different things you can do when you're thinking about how does my technology help me practice better medicine. So does that seem reasonable?
Let's do it. Yes, please.
Okay. So we began onboarding practices on the EHR side in about 2007. And we originally began with enterprise chart not enabled. And we had used different solutions over time for sharing of clinical content between practices. But what this meant is that each practice had details of the patient record stored within their own practice. Now, in 2013, as an organization, we decided to convert having enterprise chart enabled. So we turned it on. So as Jeffrey mentioned, we labeled it unified chart because we thought it made a clearer impression that each patient had one chart to which all providers had access. So we did kind of rebrand it locally. By the time we went to do this, we had already onboarded 43 separate employed and independent practices with both primary care and 15 different specialties at this point. So to prepare for that monstrous transition, we had to have a clear plan. One of the big things that we did is we reviewed all of our privacy and liability concerns with sharing of data and deployed new privacy signature forms to all the practices so they could inform their patients of how we now were sharing data. To ensure that kind of compliance, we did things like we set the privacy signature fields required to our go-live date so that we knew we were capturing that information and those approvals from our patients. We did press releases, we put signage and educational materials in the practices for patient education, but we also did a lot of education to our staff for talking points to give to the patients. We knew we had to modify all of our custom stored procedures and reports in Enterprise Chart, and we had to understand how some of that previously shared content using other tools may appear to be duplicated once Enterprise Chart was turned on. We also needed to be able to readily identify whether people were opted in or opted out. So of note, we started this giving the patients the choice, and then we soon realized it was better for us to inform the patients that they were opted in unless they actively opted out. And interestingly, we only have less than 1% of our patients who are opted out. And our own IS team controls the opting in and opting out. Practices send us signed forms from the patients for us to make those modifications. But we removed that from the practices as a deliberate choice. And I mentioned before that we knew we were going to have some duplicates because we'd been on this sort of different technology for about 6 years. And so we knew we were going to see duplicates in medications, immunizations, problem lists. And programmatically, we could remove a lot of duplicates. However, we made it a policy for medications that every practice, the first time a patient was seen, it was their practice's responsibility to do a medication reconciliation and clean up those duplicates. I modified grids to include practices who entered the information. And we thought that was particularly important for the problem list because we wanted to identify the responsible provider. Now that we're sharing one chart, you kind of have to know who's responsible. We did use some customization where we put in confidential documents per practice that could not be shared, and same with chart alerts. And as I mentioned, a big undertaking we had to do was educate all employees of employed or independent practices. What did Enterprise Chart share and what did it not? Because there was concern in many instances. So we were very clear in explaining that practice management financial information like billing, fee schedules, reporting, appointments, all that wasn't shared, right? But the EHR confidential clinical information was shared. Other things that weren't shared was confidential documents, confidential scanned images, and tasking between staff members. But everything else was shared. I also want to take a minute to mention is that we actually have two enterprises. We have Enterprise 1, where the feature is enabled, where we share everything, but we also have a second enterprise, and it's in this second enterprise where it's not enabled, where we have occupational and behavioral health because that information can't be shared. In terms of using the software to customize, we created something called Unified Chart Communication. Remember, we branded it to Unified Chart. So this allows practices to communicate between practices inside the application itself. Pretty slick tool. And so I'm gathering you can understand there was quite a bit of effort involved in coordinating, making this huge transition the way we completely shifted the way we were looking at the patient's chart. It took us about 5 months, I would say. But we've never looked back. I don't even think, I think Jeff and Jerry can attest to that. We never looked back for a second, and it's one of the best decisions we've ever made. If that's something that anybody is considering, I would say sooner rather than later. And if you're looking to even engage with NextGen, I recommend that you even start with that as an option turned on, because it's just that valuable. And as Brandon mentioned, we have 73 practices in over 105 locations, 28 different specialties, all accessing a single chart per patient. And just the sharing of that clinical content is just invaluable.
Understand, Karen is correct that if you're going live today, you absolutely would go live with Enterprise or Unified Chart, depending on what you call it, day one. Yep. But we also started this journey back in an era where physicians believed their charts were their charts. They had value. Yep. The concept of getting them to understand that the charts really belonged to the patient, regardless of whether they were getting care, is what took some time. I think today most physicians understand that, but they clearly did not back when we originally went live.
I agree with that, and I might add also that if you were opting to go live with a unified chart from the beginning, you would circumvent any of the problems that we had to correct with duplicate entries and challenging and supervising our providers in being good stewards and citizens of a unified chart environment by making sure that the medication lists and problem lists, for example, were properly managed in that environment. So if they grew up that way and there wasn't this merging of disparate charts into a unified chart where duplications occurred, that would make it a lot easier. So that would absolutely be my advice as well.
I love it. And to your point, Jeffrey, not only have we moved along and progressed as it relates to the EMR, the patient chart, healthcare IT, but what you just described, this unified chart within your organization, is what ultimately we're all striving for. It's that transparency, that single source of that patient health information. So I applaud what you've been able to accomplish. Thank you for providing that color. And I've got to be proud as NextGen for being able to allow you that platform to do it. Not many or not all can. Jeffrey, I'm interested in the financial reporting capabilities that you've been able to leverage off of the NextGen platform.
So we actually haven't done a lot of that. And let's talk as to why. Karen mentioned it's the clinical data that we've integrated. But we're made up of both employed and independent practices. And, you know, if I go way back to the very beginning, we made the decision early on that we wouldn't even host it on site, that we would use an outside hosting organization, because those independent practices, as much as they understood the benefits of coming together, still were fearful that maybe the CFO at the hospital in the middle of the night when he couldn't sleep was going to go on and look at their financial information. Obviously, that doesn't happen. So that's all siloed. Now, having said that, we have been able to use it to help us understand from a clinical perspective the types of services that patients are getting. And that has enabled us to garner shared savings from our payer community, because from a clinical perspective, we can't get the shared savings unless we're hitting the clinical benchmarks, things that were mentioned earlier. making sure patients are getting their mammographies, their colonoscopies, and so on. So in that respect, it has helped us financially. Now, each individual practice has used it, and the hospital has sets of reports that they run and they use to manage their claims payment, to see where the dollars are flowing from. But Hunterdon Healthcare Partners, we're not in that business.
Thank you.
So can I add, we do have a central billing office for our employed practices, and
Right.
they do consolidated reporting for financial information. But that's only for our employed practices, and it's completely segregated out.
Gotcha. NextGen Mobile. Karen, Jerry, I'll let either of you, if not one or but both of you, answer. But tell us a little bit about NextGen Mobile, your use of it, what that's meant to your organization.
Did you see me dance? Sorry you had to see that.
I did.
How much we love it, okay? So, we have different levels of providers accessing different levels of service. And, aside from the convenience factor, of which it absolutely is, it's an interesting tool should there be a downtime or an outage for a power failure, a connectivity issue. That's still a tool that can be utilized to access the patient's medication list, problem list, office visit notes, etc. So aside from the convenience factor, it's really impactful for, allowing us to not have huge disruptions in care if there's some kind of outside event. So, Jerry, I don't know if you had anything else to add to that, but.
One other thing to add, which is that another feature that our providers love is the ability to take photographs and add the photographs to the chart. They love it for documenting wounds. They love it for rashes. They'll take a picture of a rash and then send a message to the dermatologist saying, can you take a look at this picture and tell me what you think? So that's been another incredibly popular feature among our providers.
Yeah, I'm glad you mentioned it. Part of my role, I am responsible for market strategy for all of our surgical specialties, everything non-public health, and for so many of our especially procedural specialty providers, the NextGen Mobile has truly become the front end for so many of those providers. And you've mentioned so many parts of why, but that image capture, discrete image capture from the mobile phone that's not saved at all on the mobile phone, it just goes straight into that patient's chart, fully HIPAA compliant, is a big part of it. And Karen, you've touched on something that we even at NextGen don't often think enough about, and quite frankly, every week it seems we're having some sort of unique weather event or outside events in some part of this country, unfortunately, and you're exactly right, that the flexibility that NextGen Mobile can bring in that unusual circumstance, beyond or beside everything else that Jerry mentioned around its value in the actual clinic, is not to be forgotten. Yeah.
It's significant, and that in no way diminishes the other features that the providers love about the tool, and the different levels of service, whether you're doing dictation straight into, discrete fields, or whether you're using a scribe service. And we have providers doing all levels of services here. So, you make it work for whichever specialty or provider, has an interest or a need.
Yeah, some of our providers who are not the best typists or not the best users of even just a mouse really like NextGen Mobile because they can use the dictation feature.
Fantastic. This addition of whole person care, again, I'll open this up to any or all three of you to talk about, but as you mentioned when we were discussing unified chart, you are providing behavioral mental health, occupational health, along with 25 plus specialties of physical medicine. Talk a little bit about just organizationally the decision behind adding whole person care and what that journey has been like for Hunterdon.
I'll kick us off with that one. So as part of our participation in innovation programs that arose from the CMMI, the Center for Medicare Medicaid Innovation, certain care delivery requirements were included in those programs. An example of such a program would be comprehensive primary care. And integrating things like behavioral health and pharmacy were key tenets to that program. And really, I think, helped us get started in the concept that we could bring services into the primary care setting that were previously considered separated, and in so doing, remove barriers to care, identify ways that we could do what you're calling, Brandon, whole person care. We don't typically use that term, but really it does describe a lot of what we're doing. Integrated behavioral health was probably our first foray into this venue, and it was a particularly difficult one because in the state of New Jersey, there are very specific laws about the sharing of behavioral health information. And Karen mentioned earlier in our discussion that we have two different enterprises, and our second enterprise houses all of our behavioral health charting. And the behavioral health therapists that we integrated into our primary care practices do their charting in a separate enterprise. So we did some creative thinking and brainstorming and came up with ways that we could share information legitimately and safely to create an integrated platform so that the therapist and the primary care doctor and the care coordinator, for example, could communicate freely, regularly, and openly about the care of the patient. And we're really, really proud of that program. Then we brought in pharmacists as part of our care team, so we devised a template specifically for our pharmacists to use. We brought a social worker into the program, and not only did we develop ways for the social worker to communicate, but to incorporate the community agencies and referrals to community agencies, tracking their responsiveness, tracking the value that they brought to a patient, so we could direct patients to the most value-driven community agencies in our area, and so forth. So integrated care is where it's at, as far as I'm concerned, and we just keep thinking of more ways to do it.
And the behavioral health program, it's a short-term behavioral health therapy program. So if patients need more.
Yeah. Do you want me to give you a little bit more detail about that, or it's not really a NextGen specific, but I'd love to talk about it. So if you would like to hear more.
No, I think it's if you don't mind, yes, please, because while it may not be directly NextGen specific, this full integrated care platform is such a part of who NextGen is. So for our audience, I think it would be valuable. Let's hear about it.
So, and I'll try to particularly call out things about NextGen that are pertinent to the discussion. So in order to integrate behavioral health successfully, we had to decide what kinds of behavioral health conditions were appropriate for an integrated program. And we decided that the conditions appropriate for such a program would be mostly anxiety and depression. We do not treat substance abuse disorder in the integrated platform, nor do we treat serious persistent mental illness in this manner. So taking that concept to the next step, we needed to start screening. And this, again, is where NextGen was so important to us, because we developed great workflows to get the PHQ-9 tests done, for example. We used pre-visit planning for that. We use IMH, Instant Medical History, which is a piece of software that connects beautifully into NextGen to get those screenings done. And we used NextGen to create registries. So we have registries at each practice for all their patients whose PHQ-9 score led to a diagnosis of depression. So we could manage that cohort of patients in a very specific manner, using care coordination, using meetings with psychiatry to go over that list of patients and so forth. We did the same thing for anxiety. I mentioned earlier that we had to overcome some of the communication barriers and the documentation barriers. We were able to do that. The therapist has full access to the entirety of Unified Chart. And then as a result of her work, or occasionally his, usually it's a her, creates a plan of care that gets shared in a confidential manner so that her work is not visible across Unified Chart. It's only visible at the primary care practice. And this, as Jeff mentioned, is ultra short therapy. So that means 4 sessions or less. The reason we do ultra short therapy here is because we need to keep slots open and constantly rotating patients through the program. If the 4 sessions are not sufficient to complete their behavioral health care, then they can either go on to continue care with the same behavioral health therapist, but at the behavioral health office, or they get referred into groups. We can then leverage NextGen to pull data about the success of our program. So we look at serial PHQ-9s, for example, because the therapists do one at each visit. And we can look at the types of improvements we see between the initial PHQ-9 and the final PHQ-9. We can look at what percentage of patients go on to be seen at the behavioral health enterprise, because our reporting capabilities allow us to pull data from both sides, both enterprises. And we can see what percentage of patients achieved sufficient improvement to not need further therapy versus which percentage needed to go on to either a group or sustained individual therapy. All of that is due to the richness of the data that we have contained in NextGen.
Fantastic. I mentioned at the beginning, speaking to our audience, how we believe and have always been so proud to reference Hunterdon as a lighthouse account for NextGen. Just listening, I think, to even just these last comments from Jerry, I'd go so far as to suggest, Hunterdon, you are a lighthouse provider of healthcare in this country. And what you've been able to accomplish and what you are doing in the communities you serve is just so fantastic. We're approaching the tail end of our time here together. I did have one question that came in. We've had several but we've sprinkled them into just the course of our conversation. We touched on it just a little bit, but specific to telehealth, the question was, and I suspect, looking towards some of the other perhaps more easy or convenient standalone sort of telehealth options. The question was how onerous, how involved, what was the process like for standing up an integrated virtual visit platform? Karen, I suspect you might be the one who could answer that.
It was honestly not difficult. You know, we did do, if it weren't a COVID environment where you were trying to do everybody all at once, I would say on a scale of 1 to 10, it's about a 1 or a 2 in terms of being very simplistic. Simply by the mere fact that we had to do every single practice, every provider all at once, it probably rose to like a 5 or a 6. It was significant because of the extreme nature to service our pandemic patients, right? But in terms of actual setup, you know, there's a fantastic team, you know, with NextGen that walks you through the process. It's not an extreme hardship on any IS team or, you know, if it's a small practice locally to do. So, you know, absolutely do it. It's been fantastic the way we've been able to have that incorporated directly into the appointment book. That's so beneficial. You know, now that there's waiting rooms, you can have ancillary staff initiating that conversation, doing intake, essentially rooming the patient, right? Asking a lot of those preliminary questions that they normally do before the provider enters the room, if you will. And so, some of those features that to continue to be added on are just fantastic and really make it a smooth transition. And it's not going to go away.
A number of telehealth visits on the medical side have dropped from their, high point. Having said that, I sit on the medical side. On the behavioral health side, still very, very rich in terms of the number of visits taking place that way.
Yes, and that trend we've seen across the country, and the same mirror of the volume still prominent in the behavioral health side. So we've seen, as an organization, we've seen that exactly the same. Karen, it's what you've just described. This is not just telehealth. This is truly a virtual visit platform with virtual rooms, virtual waiting rooms, and the like. So you've sold it for us. I appreciate it. I want to thank all three of you. This has been a pleasure for me to interrupt your day in these extraordinary times and spend 45 minutes with us and our audience, sharing a little bit more about Hunterdon as an organization and certainly about NextGen in your organization. I'd welcome any closing comments if either of you, any one of the three of you had any. Otherwise, I want to thank you again. This has truly been a pleasure for me.
You're welcome.
Thank you.
Thank you.
Elaine, we'll wrap this up. I want to thank all of the folks in our audience that have joined us live, and those of you that are joining us on demand. We thank you for taking this in. Hope that you have all found this valuable. On the screen in front of you, if you should want any more information and don't have a contact person already within NextGen, please feel free to call us at the number that you see, email us at info@nextgen.com, and of course you could always just peruse us on the web browser at nextgen.com, and you will be able to get in contact with us. So thank you again. Thank you, everyone, Team Hunterdon. Hopefully the next time we have a conversation like this, we are in more quote-unquote normal times, and we can do this in person on a stage in front of a live, real audience. But in the meantime, I'm so thankful for you. Thank you.
Thank you.
Bye, everyone.
Thank you so much, everybody. Thank you very much to our guest speakers and to our audience for your time and participation. Again, this discussion was recorded, and we will send a link to that recording in a few days via email. And we hope you enjoyed the rest of your day. Thank you, everybody.
Thank you.